One thing that we do really well, and that's unique to us, is that we are able to predict high-risk complications. In that case, we have the longest prediction horizon as well as the best accuracy on the market. Nobody else can match us. So from a user's perspective, you no longer have to wait for a high-risk event to happen or for you to drop below a certain threshold. You will be notified before it happens. We can push this horizon up to 12 hours or so, and that becomes in really handy when the patient is struggling with nocturnal hypoglycemic events, which means that there's a catastrophic loss of blood sugar levels during hours of sleep. And oftentimes, especially with type 2 that's not being monitored, this could be fatal. So the patient can go to sleep, never wake up in the morning. And we often blame it on the heart. Oh, the patient had a stroke. But you wouldn't really know exactly what happened. And if the patient's at risk of diabetes, the chances are they might have a catastrophic loss of blood sugar levels during hours of sleep. What the sensors do today, they will wait for your glucose to drop below a certain value. And once it does that, then alarms go off. So you wake up at 5:34 in the morning, and your glucose is dropped to critical levels. And oftentimes the device, the reading of the device comes with an inherent delay just because of how the technology is built. So, no pressure, but your actual glucose levels are much lower than what the device reported. And the user has two options: increase the number that triggers the alert, which means you're going to get more false positives, or drop it really low, but then by the time you actually cross below that threshold, you're like way lower. For patients with diabetes, type 1 specifically, you've lost the innate capability of managing your glucose levels. You have to think like a pancreas and act as if your pancreas would. So imagine this scenario: you get up in the morning, too early in the morning, your glucose is dropped to critical levels, you don't really have any rescue carbs, you have to walk to the kitchen. Oftentimes when this happens, you get, weak hands, weak knees, can't really walk, can't really think. You can see the risks. What we can do through the Endobits companion app is detect that an event is oncoming, but many hours before the patient goes to sleep while they're still awake. And we can send them notifications that can allow them to better understand what's going to happen, so we can predict with above 90% accuracy that you're going to have a nocturnal event within this period of time. And so the user can translate that into, I'm going to eat a little bit more, take a little bit less insulin. And what we see from our patients, they either push this through the later hours of the day, reduce the impact, or they completely avoid it. That takes the patient away from, reacting, always waiting to react, to, oh, now I know something bad is going to happen. And then during the day, we can send these notifications to them within a different prediction horizon, so we can let them know what's going to happen in the next 1 to 2 hours. There's something innately human about this. You tell somebody something bad is going to happen, it's not like 60 years down the road, it's actually like the next 60 minutes or so. They're going to do something to avoid it. And what we've seen from our users is that an hour to 90 minutes is a good enough time horizon where the user reacts, but they're not reacting in haste. It's more like, oh, okay, I have enough time to react to it by the time, I eat or I take insulin. We will get to that event horizon, but that event either doesn't happen or it completely goes away, or they've reduced the impact of that specific event. So we allow the user to stay within a tighter glucose range on a daily basis. We refer to that as increased time in range. So on top of the benefits that continuous glucose monitoring offers, we're able to increase the amount of time the user spends within an acceptable glucose range by roughly 20%. And that reduces complications, reduces hospitalization, and so on and so forth.